I'm sitting here in the boring room. It's just another rainy Sunday afternoon. I'm wasting my time, I got nothing to do. I'm hanging around, I'm waiting for you, but nothing ever happens. And I wonder, I'm driving around in my car. I'm driving too fast, I'm driving too far. I'd like to change my point of view. I feel so lonely, I'm waiting for you, but nothing ever happens. And I wonder how.
The gluteal area. So generalization, blood supply is from the superior and inferior gluteal arteries arising from the internal iliac arteries. So first is the gluteus maximus. The gluteus maximus is innervated by the inferior gluteal nerve. It is the chief extensor and the most powerful lateral rotator of the thigh. Next, gluteus medius and your gluteus minimus. The gluteus medius and the gluteus minimus are innervated by the superior gluteal arteries and are medial rotators and adductors of the thigh. Next, your piriformis muscle. So your piriformis muscle is innervated by the first and second sacral nerves and is a lateral rotator of the thigh. Next are three muscles. You have your superior gemellus, obturator internus, and inferior gemellus. Also your quadratus femoris. These four muscles are lateral rotators of the thigh and are innervated by the sacral plexus. And lastly, your tensor fascia lata muscle. So your tensor fascia lata muscle is innervated by the superior gluteal nerve and it abducts and flexes the thigh. Anterior compartment of the thigh. Good. So your anterior compartment of the thigh is supplied by the femoral artery and is innervated by the femoral nerve. So, first, the longest muscle is your sartorius. It flexes and abducts and laterally rotates the thigh and it flexes the leg. Your iliopsoas here. Your iliopsoas flexes and rotates the thigh medially. And then, your quadriceps femoris is made of four muscles. Your vastus lateralis, vastus lateralis, vastus medialis, your rectus femoris, and underneath is your vastus intermedius. Your rectus femoris is also known as your kicking muscle. So, your quadriceps femoris, the four muscles, are all extensors of the leg at the knee joint. Medial compartment of the thigh. Follow me. So, generalization. The medial compartment of the thigh are known as your adductors. They are supplied by the obturator artery and the obturator nerve, except for the pectineus and the adductor magnus. Your adductor magnus is also supplied by the tibial division of the sciatic nerve, while your pectineus is also supplied by the femoral nerve, the muscles. So, the most medial is your gracilis muscle. This is your adductor longus and your adductor brevis. Tapos this big muscle here is the adductor magnus. It has an adductor minimus branch. It continues towards the gluteal area. and your pectineus muscle in the anterior thigh. So the action of your muscles from the medial compartment, they are all adductors and they assist in lateral rotation of the thigh. Posterior compartments of the thigh. So first, generalization first. The blood supply of the posterior compartment of the thigh is from the perforating branches of the profunda femoris artery. Also, the muscles of the posterior compartment are innervated by the tibial division of the sciatic nerve, except for the short head of the biceps femoris because it is innervated by the common peroneal division of the sciatic nerve. Also, action of the muscles in the posterior compartment. All muscles flex the knee and extends the thigh, and your biceps short head also medially rotates the leg at the knee joint. So the muscles. This is your biceps long head. Underneath is your biceps short head. Your semitendinosus muscle, semimembranosus muscle underneath here. Continuation of your semimembranosus muscle.
Trivia. Muscles of the posterior compartment of the leg, also known as the hamstring muscles, have a common origin which is the ischial tuberosity, except for the short head of biceps femoris, which arises from the femoral shaft. Anterior compartment of the leg.
So your anterior compartment of the leg is supplied by the peroneal artery and anterior tibial artery and is innervated by the deep peroneal nerve. So the muscles. Lateral to your tibia is your tibialis anterior. And then, if you follow the tendons from the 4 digits, this will be your extensor digitorum longus. And underneath, from the big toe, is your extensor hallucis longus. Yun. So, your anterior leg muscles act as dorsiflexion of the foot. Lateral compartment of the leg. So, generalization. The lateral compartment of the leg is supplied by the peroneal artery and is innervated by the superficial peroneal nerve. They are plantar flexors of the foot and they also invert the foot. So, the muscles, dalawa lang. You have your peroneus longus or fibularis longus, and underneath is your fibularis brevis or peroneus brevis.